Madam, I think when we make a comparison, it's very important for us to understand, especially for people who are watching this show, that how do we compare and contrast the Omicron subvariants as they do exist right now to what were there before, because we did have the Delta variant as well, and then before that other variants too. So in terms of the symptoms, the clinical symptoms that people feel, in terms of the recovery rate, in terms of the death rate as well, where do you draw that line?
First of all, I must thank you, Fatma, for holding this very pertinent discussion at a very important point in time, because this is a time we should be creating more and more awareness.
Right.
As far as the difference in the presentation of the various variants is concerned, the basic clinical features are the same.
Right, madam.
So fever, upper respiratory tract symptoms, which include flu-like symptoms, sore throat, cough, fatigue, palpitations. There was a little, we noted loss of taste and smell with Delta, which is not that observant as far as Omicron is concerned.
I think the focus is more on the voice. I think people who have gotten this variant,
it's variable. It's variable.
It's variable at the
end. Not to forget, some people just present with fever and gastrointestinal symptoms, so diarrhea, vomiting.
But so madam, I think considering that you've then highlighted all these basic symptoms at length, where do you draw a line? Because if I were to look at it objectively from a common man perspective, I think some of the symptoms were those which would actually overlap with the common flu and cold. So how do you draw that line that until unless of course you get tested, you have a test to actually testify that? How do you draw a line whether you have a flu, a routine flu, or whether it's actually just unfortunately you've gotten the Omicron variant?
There is absolutely no line. COVID can be absolutely asymptomatic. It can be mild, moderate to severe, depending on how much extent the various organs are involved, depending on how it behaves, how much oxygen a patient requires. Sometimes a patient might have very severe symptoms in way of having severe headache or severe body aches, but would be categorized in the mild variety because they are not oxygen dependent. And then we have clinical terms of moderate and severe.
So I think the advice to people out there would then be that if anybody has any of the symptoms that you've mentioned, that just isolate yourself and test yourself. Madam, I think we must also talk about telemedicine, as we do see it developing over a period of time, and I think in this regard we've seen King Edward Medical University taking a very a forward step in that regard, building up this whole telemedicine unit in which you're not only educating people about the virus, but also kind of intervening and giving them the right referral, or for that matter the right advice that they do seek. But telemedicine, as we do see it today, I think it comes with a lot of challenges too, because I think there's only so much that you can do sitting behind maybe perhaps a computer, or for that matter talking to somebody on the telephone line. So how effective do you feel has it been in actually fighting out this COVID-19 pandemic? And of course we've seen it develop over a period of time through these 3 years.
Fatma, telemedicine is not new to the world, but to Pakistan, I would just quote a quote from Maulana Rumi: the wound is the place where the light enters. I think this COVID was the wound that introduced this department of telemedicine onto the medical universities. It was back the first, you remember, on the 26th of December in Wuhan, the epidemic was declared.
Right.
The first patient came to Mayo Hospital in Pakistan on the 26th of February, and it was on the 18th of March. It was the innovation and this idea, this vision was of the Chancellor of various medical universities of Punjab, that it came up, why not start up with tele-corona services, tele-corona health tests, where people are guided as to what the virus is and how it spreads, and how to avoid and what to do in case of an infection.
Right.
And I think the credit goes to the Vice Chancellor of King Edward Medical University, the then Vice Chancellor, Professor Khalid Masood Gondal, that he said that because at the same time, if you remember, there was this first lockdown, and all the outdoors of the major tertiary care hospitals, they were closed, and they remained closed for 6 months. And on an average, as I told you, it's about 15,000 patients coming to Mayo Hospital in a day. So where would these patients go?
Right.
So it was his vision that why not extend these tele-COVID services onto tele-OPD, and he extended them onto medicine, surgery, gynae, pediatrics, psychiatry. Psychiatry was very important, especially in those days.
But I think one thing, madam, which is very important, I think for the benefit of the people as well who are watching the show, that when we talk about telemedicine, I think it just doesn't make it, you know, easier to access doctor, also easier to access the healthcare system, because I think a lot of times people, more so those belonging to far-flung areas, and I think you would agree with me on this, those belonging to remote areas, I think one of the reasons why they are so hesitant to go and seek medical care is because, number one, they feel it might be costly. Number two, they might just feel that, you know, accessing a hospital per se or going to a doctor would be so much full of hassle because it might be just too far from where they are living. So in terms of that, do you feel that, you know, telemedicine has been that thing which has actually helped us, you know, overcome this problem?
Absolutely, Fatma. Thank you for asking me this. This is something very dear to me, because we were able to receive calls and attend to patients from areas I had never heard the names of those places. Such outreached and underprivileged areas. More than 18,500 patients have been catered up till now from more than 75 districts across Pakistan, and expats, Pakistani expats from countries, more than 25 countries across the world, especially
and you've also
the Middle
gotten
East.
International recognition, which is great.
Especially for the Middle East, because as you know, the expats who are working there, they belong to the working class. They cannot afford the dinars and the dirhams and the euros and the dollars. This telemedicine service is absolutely free of charge.
Right, madam, your point is not true.
Fatma, where you talk about positives, there are negatives, and we don't need to elaborate. There have been tragedies in the family, and I hardly know of anybody who has not faced COVID or a relative having died or suffered from COVID. But as far as the positives are concerned, I can, you were just discussing about mental health. I think the stress on mental health, I think over the last 25 or 30 years of my career, I think COVID were the days when it was stressed the most. And it has actually, you know, we did a lot of training of young doctors, senior consultants on mental health issues, how to deal with the anxiety associated with COVID, and that has not only been beneficial for COVID only,
madam,
but
I think it has started so many important conversations which we were never having before. So I think another way to look at it is that, of course, it has given us that opportunity to prioritize mental health, which perhaps we were not doing before, among so many other things.
And Fatma, very importantly, I must mention reaching out. We were able to extend on to international webinars. We held national webinars. We were able to go online as far as education and medical education is concerned, reaching out to poor areas and to DHQs, THQs, where doctors, you know, we could discuss patients one-to-one.
Right, madam. I think a very important point for debate and of course clarification is the fact that, you know, people often are confused that, you know, what is the right time after which they should follow up and, you know, get their vaccination booster shot. So what do you feel is that ideal interval or ideal time after which they should do the same? Because I think the authorities here, they themselves are very divided too.
Yes, this is very important to address at this moment, because this is a time when we have reached about 62% having received their first 2 doses of vaccination, and now it's time for booster. It is very clearly mentioned in all guidelines, including the guidelines of Corona Expert Advisory Group, which are the local Pakistani guidelines, that the first booster should be given within a period of 5 to 6 months following the second dose of Sinopharm, which everybody received in our country.
Right.
And as far as the 4th booster is concerned, CDC, that is Center for Disease Control, has advised another booster following the first one 4 months after the injection.
Right.
So basically it's, as Dr. Javed pointed out, it's the waning of immunity.
Right.
So the best is, we know these are the international guidelines. A person who is at high risk, elderly, having comorbid conditions, person having immunocompromised status, people like us who are healthcare providers as well as healthcare workers, they should go for the vaccine instead of getting their antibodies tested.
I think, madam, you very rightly so pointed out all the categories, but at the end of the day, I think nobody is safe until unless everybody is safe. So everybody needs to get it at the end of the day. I think sir has raised some very valid points on which I would want you to deliberate further. When he talks about the efficacy of the vaccine, I think a very important point which we must consider now at this point in time is that the vaccination, when it came, it was originally perhaps, you know, tested on a variant which was very different from this Omicron variant that we have now. So how effective do you feel overall then would this particular vaccine be to actually, you know, help us develop immunity against the Omicron variant?
Actually, the virus is going to mutate. So today we have Omicron, today we have BA5, tomorrow we are going to have BA6. And we have seen that over the last 2.5 years. This, as far as this variant, if you ask me specifically, is concerned, it is very clear that the patients who are hospitalized, if we take their history and interrogate into their vaccination record, 98%, this is data coming directly from Mayo Hospital, 98% of patients who are admitted in the HTUs and the ICUs, high dependency units, they are unvaccinated.
Right.
So this tells you, gives you the answer how effective is the vaccination in preventing the severity of the disease
basically. Right, madam. And I think in this regard we must also talk about, you know, these various cases that we have seen, you know, more so in UK, where people have said that, you know, they've actually contracted a variant, a subvariant at one particular point in time, and then, you know, 4 to 6 weeks down the lane they've actually contracted another variant. So isn't this kind of, you know, scary, you being actually contracting the virus 4 to 6 weeks after you've actually contracted it? Because shouldn't this ideally, medically speaking, be the time in which you've actually develop immunity against that virus?
Actually, it's a variant. It has mutated. It has different transmissibility. Its structure has changed. So it has the ability, for example, we'll talk about Omicron, BA5, which is the current variant very much in. It has more transmissibility because its spike proteins, you know about those spiky projections on the surface of the virus, they have more capability of binding with the respiratory passages. So that is why there is more transmissibility. But as far as penetration into the tissue and resultant severity of the disease is concerned, that is less.
Right.
So with every mutation, and mutation doesn't always have to be bad, you know.
It can also, I think time has proven, I think something which earlier docs have also said, that, you know, with the period of time we've seen the virus be less lethal, be less dangerous, and this is something that we live through. Another thing, madam, I think which would be of, you know, real interest to our viewers out there is the fact that we have seen cases, you know, where scientists have also said that, you know, there is this category of people, whoever lucky those people are, who actually are genetically resistant to the virus. So even if they were exposed to the virus per se, they would just not get it. So how do you explain this?
Well, Allah Almighty has made everybody unique. So it's not only genetics, it's the genetics, it's the immunological system, it's the personal behavior. So many a times, if I compare myself with, for example, yourself, you may be taking all the precautions in the same environment, while I might not be. So then secondly, the immune response. Everybody has a different immune response, and we also label it as immune memory.
Right.
It might be that some individuals have had corona infection of some other, not COVID-19, of some other virus of this family previously, and are immune to it. Like just like you just talked about this, that basically one infection leading on
which
to
actually
the next
gives them that immunity basically, because, you know, we've seen a lot of cases where, you know, couples have contracted virus, but, you know, the children haven't, or on the contrary, you know, if a wife has contracted virus, the husband hasn't. So I think these are the things which actually explain. I think your answer explains all these grey areas.
But it's very important, Fatma, to point out that those who have as yet, they may feel that as yet they have not been exposed or suffered from COVID, they should not rest assured that they won't ever in their life.
But then, madam, again, I think if you are genetically resistant to it, or if if your genetics are immune to it, so I think at some level you get that protection.
Yeah, but we are not sure. But only time will tell.
I think these are again those grey areas which we can't, pinpoint and put an answer.
Fatma, I would like to share here that there was not a single day in Pakistan that we as healthcare workers did not have a kit or the PPE, because if it was not available from the health department, we would have them from the people around us. So people donated so much to the hospitals and the ICUs. It's highly appreciable, and I think the credit goes not only to the common man, but also I would like to, and I think Dr. Javed would bear with me, the doctors and the nurses and the paramedics.
I think the healthcare workers,
they would become positive. They would stay home, isolate, get treatment, and the day they would turn negative, they would join back.
I think when we talk about, of course, COVID management, we don't know, like Sir rightly so pointed out, that when exactly will we be out of this pandemic, and we can't say that, how many more mutations can we actually have or expect in the future, so to speak. But when we talk about, tackling this pandemic, we of course have to do it within certain parameters, and in this, of course, we have to give due importance to other diseases that people suffer from as well. So how do you feel can we, strike that balance? Because at some point during the pandemic, there were some concerns being raised that if you were to tackle COVID-19, if all the focus was to go to COVID-19, then how would you tackle people who are suffering from other diseases?
Absolutely. I've just mentioned that this was a big brunt on the other patient, and as I said, outdoors were closed. So dealing with COVID, many other patients who were coming for routine follow-ups, for routine surgeries, for elective procedures, they had to be halted for some time. And this is again where I mentioned the importance of telemedicine. This is a way of reaching out to people. In Surah Maida, Allah Ta'ala tells us, if you save one life, it is as if you have saved the whole mankind. If through your program, we are able to let people know, and they can further spread the message that this is a facility absolutely free of cost, and it's very easy to communicate. I'll tell you, for a person who doesn't have any internet, coming from the most rural of the places, they can use landline numbers. They are available on our website. Then people can contact us on WhatsApp, routine WhatsApp phone calls. They can make video calls. They can use Skype. And recently, Professor Khalid Masood Gundala, Vice Chancellor, he introduced the telemedicine KEMU app, which is available on Google Play Store. So it's just a click away.
All you need to do is just install that.
Just install it. You want to consult a cardiologist, a click. You want to, you're upset, you want to talk to a psychiatrist, just a click.
And this is completely free of cost.
Absolutely free of cost.
If not anything, at the end of the day, I think people get that direction that what next to do, of course, because you can't properly treat people through that app or for that matter,
absolutely,
through telephone or the
we can let them know the red flags, that this is a time you should go to an ER, you should go to the nearest healthcare facility instead of staying home.
And I think in this regard, this is extremely important because, madam, early intervention is the key at the end of the day. Well, to conclude today's show, we generally spoke about the spread of the Omicron variant. We also spoke about the very pressing need to very religiously follow all the SOPs as they have been, mandated upon us. Having said that, what is very important is that we do take this virus seriously, more so when it comes to leaving all those complacent societal, attitudes that we unfortunately have developed over a period of time. Having said that, at a very basic level, I think we all need to understand and appreciate the fact that nobody is safe until and unless all of us are safe. On that note, signing off for today. Until next time, take care and Allah Hafiz.